Hi everyone, it's Dr. Nyla. Several of you have asked about the upcoming midterm, so I have taken some time to review the study guide that is embedded within the course. I think that you will find this study guide to be very helpful. Some of you are auditory learners, so I've went ahead and put together a really quick audio. This review will mirror what is found in the midterm guide that is in your course. This review will be less than 5 minutes. My goal of this is to give you guys something just to listen to, either as you're driving or to help you guide your study time or reinforce the things that you have already studied. Be prepared to be tested on the menstrual cycle. You should know the stages of the menstrual cycle and what happens in each stage of the menstrual cycle, and also the timing of the cycle. So the best thing to do here is just to commit this to memory. Menopause and perimenopause will likely be covered on this exam. You should know the difference between menopause and perimenopause and how long these stages last. Know when it will occur and what changes are taking place within the woman's body. There are very common complaints associated with menopause and perimenopause. An example of this would be hot flashes. As a clinician and a provider, you should know how to manage the common complaints of menopause and perimenopause. What's women's health without a gynae exam? So be prepared to discuss pelvic and rectal exams, know how to perform these, know what's normal and what is abnormal, know about performing pelvic exams on a teenager versus an adult. How do you manage the patient's comfort? Know how to screen for intimate partner violence, know how to perform a breast exam, what's normal, what's abnormal, and know what the health maintenance recommendations are for women. Depression screening should be part of every exam. Know your statistics, know how to define depression, know how to screen for depression, and don't forget about postpartum depression. Next up is chronic diseases in women. Know your statistics here. Know what is the most common chronic disease or diseases in women. What is the most common cancer that is found in women? What are the most common causes of death? And also just have some awareness on Alzheimer's management. Be prepared to be tested on obesity. Know the common causes of obesity, the negative health outcomes that are associated with obesity. Look at metabolic syndrome and the management of obesity and metabolic syndrome. As providers, you are able to write for contraception for women. And because of this, it is important that you know which contraception to use when. So know the indications for contraception, what methods of contraception are available, be prepared to provide counseling to women, and also know the risk factors and red flags that are associated with contraception use. Please take a good amount of time to review pregnancy. You should be able to clearly identify different stages of pregnancy and what happens in each stage. Know about teratogens. Know what normal pregnancy findings are. Normal pregnancy symptoms that women may experience. You should be able to calculate due dates and readily identify potential complications of pregnancy. You should also be able to manage STDs during pregnancy and also know about HIV and pregnant women. And there is also a need for you to understand about termination reasons for pregnancies and the different stages in which the termination can occur and how this will affect the mom. Be prepared to identify the stages of labor and clearly discuss what happens during each stage of labor. Know about fetal positioning. Know the indications for a cesarean. Be ready to discuss red flags or identify red flags during labor. And let's not forget about the postpartum period. There will be common findings and things that will happen to women's bodies during this stage. Be ready to screen their mental health at this time and also know about red flags and potential dangers and life-threatening situations that can occur in the postpartum period. And finally, please take some time to review the supplemental learning. I am very intentional about the things that I post. Things that I put in front of you are things that I know will help you with your learning and help cover some of the learning gaps that are within the course. Being a student can be difficult, but I'm here to make it as easy as possible. I think I beat my 5-minute mark. Take care.